Start here with Dr. Wee.
Hello, everyone who's present here, and as well as those watching virtually. So I'm Erica Wee. I'm a second-year pediatric endocrinology fellow at Children's Mercy. And in behalf of my co-authors, I'm here to present on our quality improvement project entitled Improving Transition Planning to Adult Care in a Diabetes Clinic. So diabetes mellitus is a chronic condition requiring complex level of self-care. Therefore, it's very important for a pediatric diabetes clinic to offer support and prepare adolescents for success during transition. So transition here is the time wherein these adolescents, or should I say emerging adults, are beginning to take more responsibilities in all areas of their lives. So they're thinking about college, moving out, and doing all adult stuff. So that this is important just because sometimes they forget that they have diabetes, and this could lead to suboptimal diabetes control and the occurrence of complications. I just want to point out that transition in here is not the same as transfer. Transition is the process that ends with transfer. Just to give everyone a background, so the process for transition planning in our diabetes clinic includes 3 major steps. So eligible patient, that is for this project, we included diabetes patients over age 17 years without transition planning documentation for the past 1 year. They ideally complete a self-reported transition readiness survey prior to start of a clinic visit. The provider, that is either a physician or an APRN, reviews this survey and provides discussion to the patient and the family depending on their needs. And lastly, document this in the electronic medical record or the EMR. So for our baseline, our initial review revealed that an average of 22.1% of eligible diabetes patients have a documented transition plan. And our aim for this project is to improve transition planning in eligible diabetes patients to 50% by April 30, 2020. And for the methodology, so the team brainstorm ideas, we break down the problem, we identify root causes and barriers to transition planning. And in this slide shows our fishbone diagram. And those encircled in red are the areas we focus on. So specifically, lack of awareness of all involved of the procedure, providers not recognizing eligible patients, and also lack of awareness of where and how to document in the EMR. So based on these areas we focus on, we developed and implemented countermeasures, which we think were easy to do and at the same time will provide high impact on the outcomes of this project. So everyone involved, that is providers and certified diabetes educators or CDEs, were notified of the interventions and countermeasures through email and department meetings. We reviewed our transition planning documentation data monthly, and we regularly gathered feedback. And for our results, so this slide shows the run chart of our transition planning documentation. Just to orient everyone, the x-axis is the time period in months. The y-axis is the percentage of eligible patients with transition planning documentation. The green dotted line is our baseline of 22.1%, and the red dotted line is our goal of 50%. And the yellow or the gold line is our monthly documentation rate for eligible diabetes patients. So those in the yellow boxes are the different countermeasures or interventions we implemented, and the arrow is pointing at the time that they were implemented or started. So for cycle 1, so we place like a reminder notification in the electronic medical record for eligible patients with upcoming follow-up appointments. And roughly after a month, we were able to implement and develop a smart text documentation in the EMR for easier documentation and at the same time to remind people the need to document it. So as we can see, after 2 full cycles, we noted that there was an increase to 26.4% with transition planning documentation. Feedback at the time noted that time was a factor. There's a lot of things going on with, other maybe more urgent things to discuss during a very short clinic visit. And like we thought, and the other feedback was like maybe reminding everyone or putting a notification that this patient is eligible. We improve flow, discussion, and documentation. So we eventually developed a preclinic huddle, which is basically a quick huddle between the providers and the diabetes educator for that certain diabetes clinic to review eligible patients at the start of the diabetes clinic. We trialed this with 2 of our providers as a small test of change before full implementation. Both of them thought that this was a helpful intervention as an extra reminder just before the start of a clinic day. However, this was put on hold, was temporarily held because of the temporary return to telehealth visits due to the COVID-19 precautions. So during telehealth, our check-in process changed. A lot of technical issues frequently occurs, which further limit the time of the clinic visit. And then we just recently resumed the preclinic huddle intervention with all providers. And we have not reviewed yet our data for the month of April. So in conclusion, our data show a positive trend in results, and we were consistently above baseline, though we didn't make it to our goal. We are continuing evaluation of interventions, countermeasures, and monthly data collection. The transition team is also improving education planning to improve purposeful transition discussions. And ultimately, our goal is to establish transition planning as a routine part of adolescent diabetes care in our clinic. And this is the reference used for this project. And I want to acknowledge my co-authors, Dr. Erica Zarse and Dr. Lindsay Baldridge, who are my co-fellows. Dr. Sonalee Ravi, who's present here, who's our primary mentor. The Diabetes Transition Work Group, which is a multidisciplinary team whose members are listed here that are not authors, whose ideas and feedback help shape this project. The problem solving for fellow coaches. This is a GME curriculum at Children's Mercy for fellows in relation to quality improvement. We want to thank our coaches who guide us with this. Our fellowship program director, Dr. Joseph Cernich, and the endocrinology clinic RNs who work hard to reschedule some of my fellows clinic patients for me to be present here today. We also want to thank Dr. Ryan McDonough, who's one of the pediatric endocrinologists and is our Cerner EMR expert who helped us develop the smart text documentation template. And thank you all for your attention. I am glad to answer any questions.
So now we have about 6 minutes for questions. We have a little extra time. I'm going to see if I can get this microphone to work and pass around if the audience has any questions.
I can turn that. There's actually audience mics, so I'll turn this little red button, turns green, and we can hear through the mics. Perfect. So, does anybody have any questions? Yes,
I do. I wanted to ask, what does transition planning look like for patients?
Okay. So basically, as I showed the process, what we were thinking or our idea was of it, like they answer the transition readiness survey. So basically, the transition readiness survey has some questions related to transition about medication, about insurance, where they need help, or do they know how to call their diabetes doctor or the diabetes clinic if they have any questions regarding any of their relation to diabetes care. So they answer those questions, and then before the provider goes into the room, they review the survey, and then they discuss based on the patient needs. depending on what they answered on the survey. We, as I mentioned in our conclusion, we are developing some educational materials to also help our patients, like what are the most common problems that they encounter, and then document it in the EMR. Yeah, that's the whole thing of this project. That's what we are thinking of.
And very nice talk. I'm a PhD, so I'm going to ask a this question. So I imagine for transitions in care for individuals who work in children's hospital, parents have come a long way to bring their kids to children's hospital because that's areas of care. But when they make the transition to adult care, I'm assuming that they would want to see physicians or clinics in the area where they live. So does part of the transitions in care involve connecting them with specific physicians or groups in the area where they live, or making recommendations for areas that you know will take the patients with them?
So yeah, yes, our clinic has a list of like adult providers, at least in the area, and they can call their insurance to determine which of them is covered. And yes, yeah, I mean, we basically don't tell them which clinic they go. They can choose from the list that we provide them.
Clinics, because while I found as a mother of children with physicians, is you call 20 different places to try and get somebody that will take it to the clinic. So sometimes it's a new patient. So sometimes it's very, it takes a long time. So it's very upsetting as a parent to have to go through that.
Yeah, that's a good question. I am not sure about that because I mean, we all know that it depends a lot on the insurance, and that's why we wanted to start this a little early. So in our clinic, we can see our patients up to 22 years old. So if we started at 17, they have a lot of time to prepare for that.
Dr. Reed, in your transition team or in your planning, do you include patients and families in the process of how we do the planning for transition?
Well, so far right now, no, but that is a good thought. Yeah. Yeah. Thank you.
Are there national benchmarks for transition plans among pediatric endocrine practices?
As well, like Pediatric Endocrine Society provides some guidelines on how to do this, but the pediatric diabetes clinics practice differently. People have different resources, so it really, you have to tailor it to your particular clinic. That's what I do.
You said, for example, your target for 50% of patients to have transition plans. I wonder, outside of your institution, how others around the country do. It's whether that's something that everyone sort of struggles with.
Yeah, I think from what I know and based from what I have read, some of these clinics, they have basically like a transition diabetes clinic wherein the patient come in just to discuss transition, and they don't really deal with the diabetes part or like changing their insulin regimen, look at their blood glucose numbers. And some of them have like a transition coordinator as well, who specifically just look at that, follow up with patients, help them with what they need.
Obviously, diabetes is a big part of your patient population, but what about the other diseases? Do they require transition management?
Yes, definitely. I know like one of my co-fellows is working on something related to Turner syndrome. So a lot of these kids, I mean, they live longer lives now. They go to adults. So there's also a project regarding that. And yeah, there's a lot of other endocrine conditions that will need transition planning. But for this project, we specifically focus on diabetes issues.
How much time did you spend on this project, either in hours or in months?
How much time? I'm not sure. Wait. So basically the idea, as I mentioned, like this project has been going on before even I started fellowship. There's a transition working group in our clinic who's working on this. We basically just let the very idea of this started because of the problem solving for fellows. But all of my co-fellows and me are becoming interested in it, and we are planning to continue it until we finish fellowship.
Thank you very much.